Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is a situation update as of the 4th of January 2021. Happy New Year. Epidemiology first. So nationally, R naught is between 1.1 and 1.3. So for 10 people infected, on average, they will give it to between 11 and 13 people. For Yorkshire, R naught is slightly lower, between 0.9 and 1.1, central estimate being 1. Our ideal is that R naught is below 1. If I had to guess, R naught will probably be just above 1 and will probably rise for the next period in time. 7-day incidence rate, we saw drop from October to mid-December, drop from a very high level of circa 500 per 100,000 to mid-December was about 125, 130 per 100,000. From mid-December to about the end of December, it was relatively flat, and then from about 27th, 28th of December, it started to rise again. Currently, the official data says it's in the order of 200, 210 per 100,000. I expect that will go up over the next period. It's important within that to look at ages. So the age-specific 7-day rates are relatively flat in 0 to 14s, about 100 per 100,000. Relatively flat in the 65 plus age cohort, again about 100 per 100,000, but beginning to grow and seemingly beginning to grow quite rapidly in the working age population. That's the most mobile population and most likely to be in all sorts of different settings and contexts and able to acquire and pass the virus on. That underscores the importance of limiting social contacts, washing hands, wearing face coverings and keeping distance from people, the same things I've said before, and if you have symptoms, get a test and act accordingly. So I think the epidemiology will be that the virus will grow. You've seen what's happened, everyone's seen what's happened in London, the South East and the home counties. My sense is that will begin to happen across Yorkshire. Yorkshire remains in tier 3. It's difficult to call whether there'll be a change in government policy and Yorkshire will be put into tier 4 before too long. I wouldn't be surprised if that were to happen. It's always good to be on top of spread, and being in tier 4 will help us be on top of spread. Hot things in the next few months. There's a new variant of the virus. It is causing great concerns, causing me great concerns, causing people of my type great concern. It is definitely more transmissible. There's no clear evidence yet that it's more dangerous. In fact, there's the evidence on that highly equivocal. But because it's more transmissible, it will transmit more easily, there will be more cases, therefore there will be more people with severe illness as a result of that. The infection prevention and control measures for the new variant are exactly the same as the infection prevention and control measures for the standard or the wild type virus. Wash hands, wear face covering, keep distance, limit social contacts, and get test and isolate if symptoms. Tier 3, Tier 4, I've commented on that. Difficult to call how that may change. I wouldn't be surprised if it did. Vaccination is the big push for the coming months. I think the news that the AstraZeneca vaccine is available is obviously great news. That will enable us to accelerate the delivery of the vaccination programme massively. And most of the rest of the existing control measures remain in place. The importance of having good quality local contact tracing, the importance of isolation, the importance of limiting social contacts, all of those things are still in place. If we do get into a national lockdown, we may well reinstigate shielding, but that is a decision for, one, it's a national decision, and two, it hasn't yet been made. So I think it would be wise to be prepared for it, but it's not yet been made.